The majority of reasons why implants fail will be the health of the patient. What kind of medications do they take? What kind of vitamins are they taking? What deficiencies do they have? Diabetic? Those are the kind of things that really we have to figure out before the surgery so we know what's causing those things. And there are a myriad of medications now that actually cause implant failures. And we want to get a total list of all the patient's medications to make sure we know those things. And when I lecture, I typically will put those medications on a board, and there are about 10 slides we go through, and doctors just take pictures of them because there's so many medications that we have to be aware of that will cause implants to fail. What we find is that some of the surgical problems that some inexperienced doctors have when placing implants is they may overheat the bone. That's the number one thing that causes an implant to have a problem, is they don't know how to deal with the bone. They treat it like it's a piece of wood rather than a human being. And so we want to make sure that when we're placing implants that you do it with very gentle touches, very gentle hands, but it's oftentimes they haven't had the experience. And it's just going to take them more time, more exposure, more repetitions to place those implants the right way. I'm a big proponent of guided surgery and knowing how to use the tool correctly, but a lot of doctors will cut corners and not using guided surgery because it costs more. They'll try to freehand all their implants, and they may place them inadvertently in the sinus or out of the bone or into the nerve or other locations, or in colliding with each other. And they have to place fewer implants because they don't know where the tips might end up. The other thing we see a lot of doctors avoiding is the expense of a sterile field. That lack of sterile field actually creates implant failures. And so we really want to make sure that when we teach or when we talk about is sterile field's an important thing, that you really create the sterile field for the patient's benefit so that their success rate for the implants can increase.